Thank you for joining us tonight at 6. I'm Mary Nelson. This spring, the Nebraska legislature passed a bill restricting gender-affirming care for minors. The law will go into effect this weekend, and that'll happen without some specifics in place, as 3 News Now reporter Aaron Haggerty explains.
Here at Pride Health Clinic, nurse practitioner Leslie Dvorak says about 5% of about 900 patients at the new clinic are 18 and younger. When those patients and their parents have questions, she's found herself needing to say, "I don't know."
Reading the bill and listening even to Dr. Tessmer, we don't have a lot of guidance about what to expect going forward. The bill is very vague.
Timothy Tesmer is the state's new chief medical officer and ear, nose, and throat specialist. The law assigns him with crafting the specifics of when minors under 19 can be prescribed puberty blockers and hormones. The law goes into effect October 1st, but those specifics are not in place. Patients have asked Dvorak,
what if in a year I do decide I want to go on hormones, but I'm still under 19? What will be required? And right now I said, I don't know what that information is.
The delay is also frustrating to state senators who opposed the bill to begin with, like John Frederickson.
It's incredibly disappointing to get this close to the deadline and to not be given any sense of what that's going to look like for these families. It's keeping them in anguish, frankly.
He says there are already blueprints about how to best provide transgender care.
To be twiddling your thumbs and acting like that doesn't exist, that's just not in touch with reality.
Dvorak says the chief medical officer has promised to include experts in the field in crafting the specifics.
I look forward to and hope he is able to reach out to me as someone who cares for transgender patients about what this experience is.
For now, she says she won't be prescribing new blockers or hormones, but she'll do what she can.
How we can affirm their gender until we know if we can help them with hormones to affirm their gender.
Aaron Haggerty, 3 News Now.
DHHS did not respond to requests for information or an interview, but according to a Q&A on the bill, the agency says they're trying to minimize the gap between when the bill goes into effect and when regulations are put in place.